During my master's, I really focused on sleep during children and adolescents, with the aim to have a better understanding of the typical development regarding sleep, but also working in adolescents on trying to help them, creating workshops, and there is a poster about that, to improve their sleep during adolescence. And then with my PhD, I'm just shifted towards adults and working on insomnia, because maybe as you know, insomnia is the main common sleep disorders around the world. 10% of the general population is suffering from insomnia. And therefore, with this project, we aim to find new techniques, new approaches to help insomnia patients. So I'm working with Professor Lampros Perogam-Vols in Geneva. And the protocol is quite easily understandable. We are first combining a technique which is called imagery rescripting. Maybe you know that when you are tossing and turning in your bed, thinking about your day, thinking about what you are planned to do in the future days, but also your anxious thoughts, your anxiety is really increasing during this pre-sleep periods when you are in your bed, laying in your bed. And we thought that maybe we can help them transforming by the mental visualization skills, transforming the negative and anxious images and anxious thoughts into positive one, into relaxing one. So this is the imagery rescripting. And then we thought that maybe we could combine it with others to increase the power of this technique. So this is the main topic of my PhD project and of these new approaches to treat insomnia disorders. So we plan to have different groups. Some will have the imagery rescripting technique that is being implemented, and others will have a minimal intervention. It's not a completely placebo group, but it's a group with minimal intervention that is not expected to have any benefits on the insomnia. We plan to recruit around 100 patients, and the protocol will be, there will be cognitive, mood, and also polysomnography recording before and after the intervention. And there will be weekly interventions during maybe 1 month. And this is quite the main way to perform this, to conduct this study. I have 3 years still to conduct this and to test these new techniques and investigate whether we can find new approaches. The aim is not to change and replace the current technique, which is CBTI, cognitive behavioral therapy for insomnia disorder, which is really efficient. But this therapy is working on almost 70% of the patients, and there are 30% patients remaining that do not benefit from this technique. So the aim is to give the clinics new tools to offer a broadened diversity of therapies and to improve insomnia and for all patients, because in fact each patient and each insomnia could be different.